Good morning, and welcome to the Great Lakes Health Radio program on Power 96.5 FM and 1080 AM. I'm your host, Francesca Messiah from Kaleida Health, and I thank you from the bottom of my heart for listening, especially the listeners who have been with this program for years. And I want to thank you for listening to the Great Lakes Health. I appreciate hearing your feedback, and I always ask, and if there's something you want to let me, a topic we haven't covered, when you see me in the community, I can say that now, couldn't say that for a couple of years because of COVID, but when you see me in the community, please let me know if there's a topic we have not covered. In case you didn't know, Kaleida has returned to all community outreach events. We also provide speakers for your outreach program, both in person and virtual. Also, Kaleida has professionals who can address your group with over 50 topics that address health, wellness, mental health, nutrition, and we also have our new area of expertise through the Great Lakes Cancer Care Collaborative. We have cancer topics. We can discuss any cancer topic. We can discuss cancer treatment. We can discuss pre-treatment, post-treatment. For additional information on either our wellness events or topics for speakers, please call 716-863-8717. Again, that's 716-863-8717. Who is Kaleida Health? Kaleida Health, we are the hospitals. Buffalo General Medical Center, Gates Vascular Institute, Oishei Children's Hospital, Millard Fillmore Suburban, DeGraff Memorial Park. We have 2 skilled nursing facilities, DeGraff and High Point. We have the Visiting Nursing Association with nursing, physical therapy, infusion services. We offer, the VNA offers everything, the different in healthcare and home care, nursing care, but it's in the comfort of your home and it's for all ages. Also, I don't want to leave out, Kaleida has several patient-centered medical homes, many times referred to as clinics. Matter of fact, our program today we'll be speaking with a few representatives from our adult patient-centered medical home and our pediatrics patient-centered medical home. Well, on that note, we have one of our 2 guests with us today. Our guests today are Stephanie Lolito, and Stephanie is a nurse manager at our Hurdle Elmwood clinic, and that is located on Hurdle Avenue between Delaware and Elmwood, closer to, well, really, it's in the middle of the block. But on the phone we have, and we will be speaking with, and that's Ebony Cooley. Good morning, Ebony. How are you?
Good morning. I'm good. How are you?
Oh, wonderful. And Ebony is a practice manager of Oishei Children's Hospital Primary Clinic. And I just had to say that, and our topic for today, we're going to be hearing from Stephanie, and eventually, we're going to be hearing from Ebony, and eventually Stephanie. And our topic is an award they received, and it's called the New York State Patient-Centered Medical Home Recognition for our Kaleida's Adult Pediatric Clinic. And I know I was interested in learning more about this award, the New York State Patient-Centered Medical Home, as well as our listeners. So I invited Ebony and Stephanie. And Ebony, could you just share with our listeners, what is a patient-centered medical home?
Yes, so a patient-centered medical home, which is also known as PCMH, is the approach to deliver primary care to a patient that is centered around comprehensive coordination and accessible care to the community. It also means that there is a partnership between our families and our providers to ensure the families that the decisions that they are making for their children and themselves is to their best wishes. it gives us an opportunity to model achieving primary care excellence within the locations. For me, I'll speak for peds. And then it gives us a sense to let the parents know that we are listening to them and their needs for their children.
And I just want to make sure that she said peds. Peds is in pediatrics.
Peds as in pediatrics.
Now, does this include telemedicine? I know we heard a lot about telemedicine. Not we heard about. We had for a fact telemedicine during the height of COVID, before or after. Now, does that include, when you talk about comprehensive, does that also include, can that be accomplished through a telemedical conversation?
Yes, we do have the ability to offer telemedicine appointments. Right now, currently in our pediatric clinic, we offer that for our asthma patients who have telemedicine normally on Monday mornings and then Wednesday afternoon and evening to help out the population. And that's post-COVID. So during COVID and pre-COVID, we offered telemedicine to our entire population, and it was based on whether or not the patients were comfortable in coming inside the clinic or if they wanted that visit. And then we also still have some telemedicine visits upon request for the primary pediatric clinic.
And now, and I know we're talking, we are focusing currently on pediatric clinics because that's where you are, practice manager, Ebony, for Cooley, for that practice manager for Oishei Children's Hospital. But my other question, do they offer telemedicine at the sites where Stephanie is currently located at Hurdle Elmwood?
Yep, Hurdle Elmwood does offer telemedicine visits as well.
Mm-hmm. Okay. Now what are, okay, so we talked a little bit, and where are all of Kaleida Health sites that aren't in the hospital, are they all patient-centered medical homes?
Women's Health is not. We have an ambulatory women's health that's outside of the hospital. They are not. But the adult Hurdle Elmwood is, and then the primary pediatric clinics are as well.
Okay. Now, you talked a little bit on it, but what makes it when did patient-centered medical homes come into existence, and what makes them unique?
So the Patient Medical Home Center has been in existence out from what I know to be 10 years that the Oishei has been involved with them. I only been a practice manager for 2 years now, so I know that is the requirement is yearly, is an annual requirement. And then what was the second portion to your question?
Well, and what makes it unique?
What makes it unique is having that ability to provide care for physical and mental health needs, including prevention and wellness, as well as acute and chronic health issues. And I believe it holds the clinics accountable to make sure that we are serving the community by certifying and following the credentials and submitting the information to support that we are actually doing this in our clinics.
Mm-hmm. So if someone has let's say in this case, so if a child comes into, where are the clinics? Where are the clinics located, such as the one that you're currently housed out of?
Okay, so our adult clinic is Hurdle Elmwood Medicine, and that's located at 900 Hurdle Avenue in the city of Buffalo. And then for the pediatric clinics, we have two locations. One is at 1021 Broadway in the city of Buffalo, located in the Jericho Road building on the second floor. And the other is 1050 Niagara Street. And they are located in the Best Self building right off of Niagara.
Okay. And I just want to mention the one at 1021 Broadway for our listeners who aren't sure where that is. That's next door to the Broadway Market. So you know where the Broadway Market is, 998 Broadway. Next door is it's a large building owned by Jericho Road, and Kaleida Health has a pediatric clinic in there. And the one on Niagara Street, I know there are many Tim Hortons, but there's a Tim Horton that shares the parking lot with the Niagara Street location, correct?
Correct. Yes.
Yeah. Yeah. And so I'm adult caregiver, bringing the child I'm caring for into your facility for regular primary care checkup. Now, is someone going to ask me, do I want other services, or is it up to me to tell? And who am I telling if I need some coordinated services? How is that connection made that I, the adult caregiver, need some more services for my child?
Okay, so we have a couple of different tools that we use in assessments, what we call screeners. For our patient population who's newborn to 3 years old, we have what you call a We Care screener. That screener is a list of questions that we ask the parent, and we do it as voluntarily. They have the option to not answer that screener, and then they have the option to answer it, and it's kept confidential. Upon that, we get that information from the screener. If the patient scores positive or have the need, the provider hooks them up, the provider links them with our social worker, and then we identify the need, and we go from there with helping our patients and our parents. For ages 4 and up, we use different screening tools that's in our Cerner EMR, which would include a depression screening, a care coordination and care transition screenings. And there are certain questions that we ask to our patients. And if they score positive, we follow the same procedure. We discuss it with our provider. The provider discusses it with the parent, and then we link them to social worker. And then our social worker from then take on the services and get the patients linked up. And then we just have open communication. If our patients and family express, whether it's to our medical assistant who is assessing them during vitals, or if they assess to our licensed nurse practitioner who's giving them a shot, any level of care, if a parent express that they have concerns or needs for their children, we take that information back to our provider, and we have the provider address that in the room. And then upon assessment and what the result of that was, the provider then sends it out to our social worker. So it's like a circle. They come in, we ask questions, they give us information, everything is presented to our provider. The provider assess our patients and the screeners, and then from there they link with social work, and then we link them to additional services that they may have.
And Ebony, I must say one keyword which makes all of this possible. But I just want to say one thing that you definitely do very well, it sounds like, is that you listen.
Yes.
And none of this is possible without listening. Well, this is a question for both Stephanie and Ebony. Please explain the importance of receiving the New York State Patient-Centered Medical Home recognition. Why is that something the community should be proud and give you applause?
So I think that the community should be proud because it gives us the opportunity to show that we are consistently listening to the needs from our patients. We hear that you need resources and help, and whatever the help or the resource is that you need, that you can come into the clinic, that it's confidential, the information that you share with us, and that we have the different tools and skills and assessments to give to you, and that it holds us accountable. I think accountability is like the best thing that I could offer to you as a parent or a patient, is that we are held accountable to provide you with the best excellent care that we can give you. And the PCMH recognition shows that we're just not saying that we can do this, but it backs us up to say that we have done it when we achieve that achievement.
can you tell me, I mean, some of the staff, so do you then connect through the medical home? Are you then able to connect, let's say, I know we talk about obesity. I know we don't like to think of our children as being obese, but are you able, you talked about mental health providers, but are you also able to link the caregiver who's bringing that loved one in with like nutrition and someone to help with weight loss if they need be?
Yes, we also have another screener for our children if they score positive on the, obesity. So currently in our pediatric clinics, we are going to be hiring to have a nutritionist on site. We currently refer out to a list of providers that we are normally linked with. And then from there, so they come in and they'll do the assessment and the provider will refer them out currently. But we are working on to where we would have a nutritionist in our pediatric clinics on site where the family can get that help from. In addition, we have 2 markets every Thursday and every Friday at both locations, 1021 Broadway and 1050 Niagara Street, where our patients can get fresh fruit and vegetables at a discounted price. But also we have vouchers that we give to our patients, and that voucher is normally worth $10, and they could go down to the market and get $10 worth of fruit, fresh fruit and vegetables, to give them some assistance with just learning how to eat better.
Mm-hmm. Is there someone to help them with the cooking side of it, in terms of how to cook? I mean, along with eating healthier, is there someone to show them how to prepare the meals?
Yes, and they do offer free cooking classes, and they normally have flyers on the table with a calendar of events. So yes, they do offer that as well.
I mean, this is brand new. I didn't realize. Where are the cooking classes held?
I believe, Buffalo Go Green. I don't have the flyer in front of me, but I think they have locations. I know Jericho Row offers some classes as well right here in the 1021 building. And then I'm not sure of the address on Niagara Street, but there is another building on Niagara Street that they offer the classes in as well.
That's wonderful. I mean, not only does that, I mean, that just helps you with your overall health, because I know for our listeners, things such as obesity, overweight, I mean, those things can, I believe, be detected as early as age 3. And so I just want people to be aware of that. And I know a lot of times everyone says, that little baby's so cute. Look at those chubby cheeks. I'm guilty, but sometimes you have to be careful, because we want our children to grow up to become successful and healthy adults. We definitely want that.
Yes. I would just add to that, when you down at the markets that's outside at the clinic, that the staff there that is actually there to support you also provides education. And, if you're not sure what a vegetable is or how to cook it, they have some advice and they give you out education as well.
Do you have diabetes information by chance for the parents?
Not at the pediatric location. We don't really deal with a lot of diabetes in children. Not to say that, I know diabetes exists in children.
Right.
I believe that they have additional resources. They should have additional resources down there. I'm really not sure. I will have to get back to you on that question.
Okay. Now, and Stephanie, whenever you get on, just please let us know. Just let us know. Are you able to connect the parent if the parent has a question? I know you're able to connect the child to the services. So what would you do if the caregiver has the adult, the caring adult that's with that child, the parent, the grandparent, great grandparent? What if they have questions about something about their health? What then happens?
So normally, if we have a parent, I'm a parent, so I'll use myself as an example. If I brought my child in, to the clinic, and I expressed that I had a need for, health information. The providers will not assess the patient because they are adult and this is a pediatric clinic, but what they will do is again, link them with our social worker, and then our social worker will try to help them get set up with adult services. And so normally we refer internally. So that's when I would send Stephanie a message and coordinate with her to try to get that patient in and see what services that her clinic would be able to offer to the mom. So that way the mom is not and that we're not just only focusing on the child.
Stephanie, if you could just talk about the 900 Hurdle location, which is the patient-centered medical center home. Could you talk about a little bit about that and the services that you provide, and what age really? So what age does Ebony stop seeing patients when, and what age do you then begin to see patients?
Certainly. So we started 18 and older. So we're adult services only, and we're located in Hurdle Elmwood, 900 Hurdle Avenue here in Buffalo. And we provide a wide variety of services. Mainly, we are primary health, right? So we're able to provide physical health assessments by our physicians teams. We have a mental health care with our on-site behavioral health counselor. We have nutrition consult, which provides education and proper diet, as well as other specialty services. We have gastroenterology, podiatry, cardiology, plastics, and mammogram screening. The bus comes to the parking lot once a month so that we can provide the mammogram screening here at the site. We also have social workers on site to assist with medical equipment, transportation is needed. With our office location, we have a bus stop right out in front of the office. So this is, we're being able to have all these services on site, allow the community ease access and one location to get their healthcare needs met.
Mm-hmm. That's great. Now, do you have, so if someone is, let's say one of our listeners or the parent, the adult, the grandparent knows their child is getting ready and just to turn 18, but they've been with Ebony, part of the primary care clinic. Is it an easy transition? Like, are you able to get the records electronically from Ebony because the person wants to stay with the patient-centered medical home, but they just want to go to the adult? Is that an easy transfer?
Absolutely. So a couple things can happen. One, the patients can call directly, and our phone number is 716-871-1571, and let us know that they need to become, a new patient here at the clinic. The other thing is if they have told Ebony or the office staff that they want to come here once they age out of the children's center, then their records can automatically be sent to us, and then we can contact the patient for an appointment here to get them started here at our clinic. And because we're all of Kaleida, right, we share the same information through the electronic medical record. So there's no more waiting for your faxes or your records to be transferred or communication by providers. That's easily done right through the computer system, and we're able to see everything.
How about prescriptions? If you've been with Stephanie, if you've been with Ebony's patient-centered medical home, and how about like if you're asthmatic and you've been getting your prescriptions at XYZ pharmacy, are you able to, is that an easy transfer as well?
Absolutely. So that is part of the medical record as well. Their pharmacy information is saved right into the health system. And so when their medications just transfer over, we are able to see what medications that the patients have been on. So that's something that is reviewed at every visit. We see what medications the patients are still taking. And then we make sure that we're able to renew those during their visit. And it's sent directly electronically to the pharmacies. There's no paper scripts for that anymore either.
And I know we're really short on time now, but Ebony or Stephanie, do either of you have evening or weekend hours?
So we do not have weekend hours or evening. The office does close at 5 p.m., but we do have a 24/7 on-call service. So after hours, if you do feel like you're having a medical emergency or you need some assistance or direction, you can call the same office phone number. It goes right to the on-call service where you do get a provider. So if you need something that can't wait to the morning, you can try that. And obviously, if you're having a medical emergency, you would still continue to use 911 or the ambulance or emergency room for, urgent situations.
And if you could just share the phone number, Stephanie, then Ebony, I'm going to ask you to share your number again. What's the phone number, Stephanie?
716-871-1571.
And Ebony?
And our primary PEDS Niagara location is 716-768-7600. And our Broadway location is 716-630-8900. And Francesca, we offer at the primary pediatric clinics no weekend hours, but our Monday is our evening clinic and our last appointment is at 5:30.
Okay, thank you. And ladies, Stephanie Lolito, who is a nurse manager at Hurdle Elmwood Clinic, and Ebony Cooley, our practice manager at Oshai Primary Peds Clinic, and both of our pediatric, not clinics, I'm going to use a new term, patient-centered medical home, because it's more than that. It is a home. It makes you feel like you are at home. Why? Because they can connect you with many services beyond what they offer. They'll connect you to the correct provider within our Kaleida network. I want to thank both of you ladies this morning for being on the Great Lakes Health radio program. So thank you both. And next week, you will hear from my esteemed colleague, Cindy Bass from ECMC. And I'll see you in 2 weeks. I'm your host, Francesca Messiah. Bye-bye and be safe.